Hi, this is Nada Abou El Seoud presenting the second part of the treatment of autism spectrum disorder. As you may have seen, Laila presented the first part from a cognitive behavioral perspective. I, on the other hand, will approach it from a biological perspective. The article I'm going to present is called Treatment of Autism Spectrum Children with Thiamine Tetrahydrofurfuryl Disulfide. The article discusses the clinical and biochemical effects of thiamine tetrahydrofurfuryl disulfide, also known as TTFD, as a treatment for children diagnosed with ASD. The study consisted of 10 participants tested on the basis of 3 biochemical studies. First, urinary analyses, second, hair analyses, and third, erythrocyte transcatolase. The method used for diagnosis is E2, which is a computer-assessed symptom score. The method used to track treatment is the Autism Treatment Evaluation Checklist. The basis hypothesis from previous studies by Waring and Associates entails that children with ASD suffer from low levels of sulfur in the plasma and abnormal levels of it in their urine, and the TTFD reestablishes that balance by being a sulfate donor. In this study, TTFD was provided to the children in the form of rectal suppositories. The erythrocyte transcatolase was measured at onset and on completion of the study to document intracellular thiamine deficiency. 8 boys and 2 girls at ages ranging from 3 to 8 years were randomly selected for the study and given 50 milligrams of TTFD twice a day. Parents filled an ATEC at baseline and at the end of the study, and if the children were receiving a separate treatment, it was allowed to be resumed. Urines from patients were examined at outset after 30 days and after 60 days of treatment, and a control group of 19 healthy children's urine was collected for means of comparison. Samples were coded by a third party for blind study to ensure reliability and consistency. Hair samples were collected at the beginning and at the end of the study. Concentrations of metals in hair were determined. The group of children in the study was heterogeneous in terms of symptoms for ASD, which means that there was a broad spectrum of shown signs among them. Results of TTFD administration showed improvement for 8 out of 10 children. The results, even though preliminary, show that TTFD can be a treatment for autism in children. They also imply the presence of a positive relationship between SH reactive metals such as arsenic and the occurrence of ASD. Despite the encouraging results of the treatment, there were some side effects amongst a couple of patients. One patient's symptoms worsened and the other 9 displayed only an unpleasant odor. For this patient, the rectal suppositories were stopped. Another 2 patients showed irritating rash that was stopped when TTFD intake was eliminated. Patients with autism normally show high levels of arsenic in hair and urine, which was declined after treatment and TTFD. To sum up, 8 out of 10 patients improved with the treatment of TTFD after 60 days. Urinary concentrations of arsenic were higher in patients than in controls. Urinary mercury increased in all children after treatment. Therefore, TTFD may be a significant addition to therapy for ASD. However, to put the results in a practical frame, limitations had to be considered. First, the sample was too small to determine statistical analyses, and second, there were abnormal results in some chemicals that need to be further studied and investigated in future studies. Here's a summary of the main points you need to remember. For further reference, you can check out the article online through the reference provided or email me at the furnished address. Thank you for watching.